Welcome back, everyone. It's 9:24. We're on Health Watch here, and back to school means back to sports as well.
It does. The most common sports injuries, sprains, stress fractures, that sort of thing.
There are some things those student athletes can do to help stay safe this school year. Dr. Alfred Mansour is a pediatric orthopedic surgeon with Children's Memorial Hermann Hospital. He's here to share those. Good morning to you. Thanks for joining us. It seems like we have so much drama going on around Houston right now. We don't want to add student injuries on top of that. So we really need to think forward. How do we protect these kiddos, and what is some of your best advice?
So a lot of kids are getting back to sports that they had the whole summer off, and so just having them ease back into it. These kind of ramp up quickly programs, kids start getting stress injuries, they get overuse injuries. Our throwing athletes want to make sure that they're easing back into throwing. We see a lot of elbow injuries and whatnot. And then appropriate equipment. Don't wear your older brother's helmet because you think it may fit, and it's a tough time with all the Hurricane Harvey stuff. That may be a more difficult issue, but appropriately fitting helmets for concussions, appropriate techniques to prevent head and neck injuries, those are some of the more devastating ones that we see.
And doctor, here's the other thing. A lot of times kids can be fearless when it comes to getting out there and getting hit hard out there on the field. But let's talk a little bit about easing your way into the sport. It's very important to take a few minutes to stretch and
absolutely
really get your muscles fired first.
We need to warm up. I mean, adults are the biggest examples. We really need to warm up, but kids the same thing. Need to warm up in that, not just stretching, but also getting the blood flowing, getting the oxygen to the muscles so that they can now tolerate the higher activities. So really taking time to stretch appropriately. So learning good techniques either from your parents or from coaches or for some reputable online sources to just be able to safely play the sports at the high level that we want to see our kids do it.
So how important is it for the coaching staff to be a partner in this process and not say no pain, no gain, but all right, you've been injured, let's work you through this so that you don't cause permanent damage, so that further on down the road you can be a benefit to the team and you can have a good experience as well.
Yeah, I think that you bring up a great point. The coach can either be the player advocate or sometimes can be that adversary role. I just try to encourage the coaches to remember that kid is someone's child and that you have to be there to say, you know what, there's something beyond sports, and really there's not a sport that it's worth having an injury in a kid to be able to progress in that sport. So just tell them whatever you have to do to stay injury free. There are lots of more important things.
And seek treatment. Don't ignore the signs and symptoms. Come to you. You're going to take care of them, right?
If it hurts, there's a reason. Yeah. Doctor, thank you for the advice and the wisdom. We appreciate it.
Thank you.
Doctor, thanks for coming in.
Yep. Thank you.